Some big changes with CDC recommendations. Hi, I'm Dr. Brian McDonough. Let's say you've been to a party and you were exposed to someone you know had COVID. The recommendations have changed. Here's what they are now. I don't want to go over the past. I'm going to talk about where they are now. If you've been fully vaccinated and boosted, that means 2 Moderna and a booster, 2 Pfizer and a booster, Johnson & Johnson and a booster. If you've had all of that done, you don't have to isolate. You can wear a mask for 10 days and go out into public. If you have only had 2 doses of the vaccine, or if you've had 1 dose of the vaccine, or if you've had no vaccine, you have to spend 5 days in isolation and the next 5 days wearing a mask, assuming you don't test positive. So there's a key advantage to getting fully vaccinated and boosted. If you are someone who has tested positive, what do? Whether you've been vaccinated or not, whether you have been boosted or not, you essentially have to, at that point, stay in isolation for 5 days. And then if you don't have symptoms, you can then go out into public wearing a mask for 5 more days. That's it. The CDC has simplified it. They've done it for a lot of reasons. What they're essentially saying is we are going to have a mass of people who have COVID because of Omicron. Most of the cases, especially if you're vaccinated, are not severe, and we are going to keep things moving. But again, any questions, check with your doctor. But this is the Centers for Disease Control and Prevention, which has now come out with their recommendations.